use it on a daily basis. Felt guilty if I missed a day. After I had my coffee or after I took my vitamins, I could jump in there and do it, in a heartbeat and be done with it for the day.
Patients will travel distances to see their doctors and will travel distances to have their surgery. They sometimes get reluctant to travel distances to see their physical therapists. In this community, because the patients are a little bit older, they are reluctant to drive even 20 or 30 minutes on a daily basis if they don't have to. In addition, we have patients who come from over an hour away for their surgery, and for them this is a perfect solution because not only do they not have to drive all the way here to see a therapist, but in many of their communities they don't even have physical therapy.
With the paper handouts, I think it relies upon the patient to, one, remember what they did in the clinic, and two, kind of what is their interpretation of the exercises as they're printed. And even though our best efforts are there, a lot of them come back with questions. So we spend a lot of our second visit reviewing the same exercises. That's the difference with VERA versus the home exercise program.
For most patients, they need interaction, and they need to know that somebody is monitoring them. Because if things aren't going right and they have questions, they need the ability to ask somebody.
I think patients like the fact that VERA is always there. They don't have to have an appointment, so they can kind of do their exercises when their body clock says it's time to do the exercises, as opposed to, what the clinic has available.
Flexibility and the ability to do exercises on their own time, as well as the ability to adjust what they're doing without having to travel, has been what patients have liked the most.
If you can operate a remote control, you can handle this VERA program.